It's critical that patients who have got chronic illness maintain the relationship they have with their GP and keep their appointments. Appointments don't have to be physical appointments in the surgery. Telehealth appointments allows those appointments to occur without the inconvenience of travel and the risk associated with exposure to infectious diseases. But it is absolutely essential that they are maintained. It's easier for the patients, doesn't involve them having any travel time. If their mobility is compromised, they don't have to get out of the house, get in a car, park, come into the surgery. All those things are physically demanding, and if they have significant respiratory or cardiovascular or mobility issues, they're very happy to avoid all that extra physical strain. In the event that there isn't any complications to the standard appointment, often they can be done through telehealth. In the situation where that's not the case, you can always arrange a follow-up in-person appointment to assess a lesion which you're concerned about, or go through some other procedure that might be required. And so we've been providing this service to patients when required for many, many years, and it's very nice now to have some government support for the service. Availability of funding for the telehealth service is going to allow us to use that model with chronic patients much more.
As somebody who has a chronic condition, which mine is heart and lung, having telehealth has been mind-blowing for me this year because I've never been able to utilise it before. And I've had a recent diagnosis of PTSD from a trauma I suffered, and leaving the house has become even harder for me. So I've been able to travel to places without actually travelling that I never thought was going to be possible. I'm going to be doing my chronic conditions management plan again. It'll be done by telehealth, and that's going to be a huge weight off my shoulders because my GP's in the city. So I won't have to stress about that, and I'll be much calmer and much happier. I'm not immunosuppressed, but I'm at a very high risk of ending up in ICU very sick or dying. So being able to prevent being out in public, especially when there's colds, flus, and of course COVID, wherever possible, I'm going to be looking for that option. A whole world has opened up for someone who would normally be quite isolated, and I find it very exciting, and I'm just really hoping that we're going to keep going with this. This is here, it's ready to use. Why would we stop it? I've been living with chronic illness now for some 15 years, and it helps me in particular because I have more than one chronic illness. So I have a lot of GP reviews, I have a lot of specialist reviews. It gives me the flexibility in that I have been less reluctant to perhaps phone up and cancel or reschedule an appointment because I'm not feeling well enough. So in that regard, it's ensured continuity of care and maintaining my appointments. I've been able to utilise telehealth for the majority of my sort of care needs, and again only have face-to-face appointments with doctors when they needed to sort of physically examine me. Having a telehealth conference has indeed assisted me to be able to avoid sitting in waiting rooms with other people who might have cold and flu symptoms or even COVID. I'm a person who has a disease which means that I'm immunosuppressed. So in that instance, I feel safer and I feel confident being able to maintain my appointments because I know I can have a telehealth and I don't have to come into contact with other people, and they don't have to come into contact with me. It would definitely assist me if the telehealth conferencing was made available beyond the deadline date that's been given. Life with chronic illness is challenging enough, and having that flexibility to be able to manage your appointments via telehealth has certainly helped me to feel more empowered.